Oh, no, I don't.
The committee will come back to order, and members and guests will take their seats. We'll return to the agenda at this time and move on to the sixth item on the agenda, which is the Department of Health and Human Services budget closeout. And we're going to hear from Ms. Kirkpatrick with the Office of State Budget and Management. Ms. Kirkpatrick.
Good afternoon. Good afternoon to the chairs, to the distinguished members of the committee, Secretary Bosch, and the public. My name is Pam Vlachery, and I am Assistant State Budget Officer for Health and Human Services in the Office of State Budget and Management. Today I've been asked to give an overview to this committee on how the Department of Health and Human Services concluded the state fiscal year that began July 1, 2013 and concluded on June 30th, 2014. So to orient you, I have 10 slides from the opening slide to the closing slide. So it's a fairly brief presentation today. I'm going to try to hit some of the high points. What I plan to cover is the final working budget that was authorized for the Department of Health and Human Services for the department in total, as well as the 11 distinct appropriations that this body makes to the various program areas of the department, reflecting for you their final expenditures and balance of budgets unexpended. I have included one slide each, one for Medicaid and one for mental health, since those are areas that we talk about extensively in this committee. I wanted to go through the carry forward process. Carry forward is a process where we look at the end of this fiscal year after the expenditures have taken place, and we attempt to distinguish from general fund cash money that needs to be removed from the cash. So what the law tells us is that unexpended balances at June 30th revert to the fund from which they're appropriated. So in this case, we'll be talking with you about dollars that were in the department's budget at June 30th, where they were encumbered by a legal documented encumbrance, where there's statutory language that directs us to carry forward money out of the general fund. And the largest portion of this is where there is cash, because of the timing of where we are in the fiscal year. There is cash remaining in the state's checking account, if you will, but doesn't belong to the state because it's federal dollars or other unearned revenue. And then, of course, the very end of the closeout process, we will walk through reversions by division across DHHS. And this is money that is returned to the state's general fund so that the legislature can appropriate that money as ending cash balance and is appropriated in the subsequent year appropriations bill. So the first slide is where we usually start in this type of a presentation with a macro look at the Department of Health and Human Services in total. To orient you to the slide, this is all what we call the 1X General Fund Budget Codes for DHHS. The authorized budget is the budget that is enacted by the General Assembly and modified through certain budget revisions or budget actions. Typically, those actions can be categorized in two types. One is the distribution of statewide reserves, where the General Assembly appropriates money, say for employer benefits or other things that go into a statewide reserve and are intended to be distributed and spent in the operational divisions of agencies across state government. The other types of authorized adjustments that you see here are those where circumstances are unforeseen or are unanticipated at the time that the budget was enacted by the General Assembly. And those are executed under the provision of the State Budget Act, GS 143 C64, that spells out very limited circumstances under which the director of the budget might modify the enacted budget by the General Assembly. So the budget you see here in authorized is every change and the final authorized budget for DHHS. The expenditure information through June 30th comes directly from the North Carolina accounting system, and it reflects the final numbers when we close the books on Medicaid. The only caveat to this is how the department closes on a cash basis. Of course, OSC, as our state's accountant, will follow up and do a final CAFR reporting, which is published in September, which will further report the position of the material programs of the department as well as the state in total. The balance is the difference, just the mathematical difference between the final authorized budget, the actual expenditures that took place in the department through June 30th, and the balance remaining. Total requirements is spending from all sources. Receipts in the budget column are what was anticipated to be collected during the year. Actual receipts are based on what expenses occurred, how the department accounts for them, and their complicated cost allocation methodologies that are aimed to get the maximum return to the state for dollars spent from federal resources. The difference comes out of the state general fund appropriations of tax and non-tax revenue that appear in the appropriations bill. The only other thing I would say about this slide is that balance of unexpended total requirements, balance of unexpended receipts are sort of budget, they just end, they lapse. But the balance of appropriation on the bottom line there of $104 million is ultimately what was the reversion of tax and non-tax appropriations to the department that went back to the general treasury and is part of the state's year-end balance. This slide, if you'll recall the bottom line on the previous slide, what this does is take those same numbers, $18.4 billion in total expenditures, $13.574 billion in total collected receipts, and 4.89, get my glasses, in appropriations. That reconciles to the first slide that you saw, and what this presentation is how that occurred over the 11 distinct appropriations that this body makes to DHHS. So DHHS does not get one large appropriation of almost $5 billion. They get those appropriations distinctly to support the divisions and activities that you see represented before you. The obvious observations are that Medicaid and mental health are the two largest appropriation expenses within DHHS. Together, they make up just under 84% of the spending for the Department of Health and Human Services. In terms of total requirements spending, Medicaid still takes first place, but it's followed by social services, and that's a reflection of how local service providers, local DSSs and others are reporting expenses and being reimbursed, booking local matching funds and drawing down federal dollars that are transferred from DSS out to the counties. So this slide deals specifically with the budget for the Division of Medical Assistance. So the division authorized budget, I won't read that to you, it's in the right-hand column. Total appropriation of just under $3.5 billion. When they expended through June 30th, the remaining balance was $63.6 million. Now I'd like to expand upon that just a little bit. We in this setting in the past have talked about what is the composition of the cash that reverts out of the Medicaid budget. And we've had a number of conversations about drug rebates, federal shares of drug rebates, funds borrowed, funds not borrowed. So to back up slightly before June 30th, after the last check write was made and after the last expenditures in Medicaid were recorded, there was just under $100 million in cash remaining in the Medicaid budget. It was $99.8 million. When we looked at that cash, we looked at that in consultation with the Office of the State Controller. We took into account the guidance of the state auditor, and a decision was made that any of the cash that was collected from drug rebates that occurred after the last check write and after the last opportunity for the Medicaid agency to be able to credit back federal shares and net that from a subsequent federal draw would be removed from the general fund. And the purpose of that was to be able to bring that cash into the new fiscal year and then net down the next federal draw and mitigate or actually eliminate the impact on the Medicaid budget for the year starting July 1st. So when we get to the carry forwards, we can talk about it a little more fully. But of that $99.8 million, $26.6 million was credited as it was removed as federal share of drug rebates, and $9.6 million was federal share of other items. And not to be obscure about that, that's recoupments from CSC, where payments are made to providers and are recovered, and that has not finally been dispositioned, so the federal share of that was calculated and removed from the cash balance. So that's what you're seeing up here, and the bullet point is that we have made every effort in working with the state controller and with the department to ensure that the $63.6 million that did revert was 100% general fund appropriation. Of course, when we talk about why we had $63.6 million reverting, that has also been debated in this committee. I would say that when the governor prepared and recommended a budget early on to the General Assembly, there was the assumption made that some portion of money unexpended at June 30th would likely be attributable to some form of a backlog, whether that was in enrolling recipients or whether that was in paying providers. The legislature agreed with that and made a non-recurring appropriation to the Department of Health and Human Services for the year beginning July 1st to try to take that into account. So what exactly has contributed to that, I think, will be unfolding as the year goes forward. But what we do know is that of the $63.6 million that reverted, it is the sum total of pluses and minuses across all the activities of DHHS. That would be administrative, contract expenses, cost settlements, and all the things that they do. $60 million of what you see there was reverting from Fund 1310, a term of art, but which specifically refers to those fee-for-service and buy-in programs where we typically think of the direct fee-for-service payments to the providers. This slide is specific to the Division of Mental Health. So we see their final authorized budget in the left-hand column. their actual expenditures through June 30th in the middle column. And we have a reversion from the Division of Mental Health of just under $1.5 million. The department, again, something we've discussed in this committee on more than one occasion, is that there has been a recent history within the Division of Mental Health of having, at June 30th, outstanding liabilities. So really, what does that mean? Because we talk about Medicaid as a shortfall, we talk about mental health as outstanding liabilities. What it means is that when June 30th ends, there are invoices that are unpaid across the Division of Mental Health, and those invoices are the first things that get paid when the new appropriation occurs July 1st. We would ask, who does that affect? That is a function of